Hello and welcome to this session on a very important topic that will materialize One Health and take it to the public. Uh, the importance of communication in health is now stressed everywhere in the world, and the importance of health communication, especially for engaging the community and media to promote the cause of One Health, is very, very important. And in this unit, what we'll try and do is we'll look at two broad areas. One is the community engagement, and the other one is media engagement, and how using media one can do various health communication related activities like advocacy, social marketing, and what's the role of new media. So, initially, for the first topic, I will take up the role of community and ways for community engagement. And in this particular session, you will learn some basic things about One Health and what exactly makes One Health work, and why one needs to engage with community, and what and how do we define these communities. If there are any principles of community engagement, we'll look at it. And most importantly, approaches for community engagement, we'll see. This is going to be a basic theoretical knowledge on community engagement. These are going to be the contents of today's lecture. So, initially, let's try and introduce to the concept of One Health. I'm sure by now, after going through so many units, you already know what is One Health. So, I need not go much deeper into it, but it is generally an integrated, unifying approach to balance and optimize not just of health of the people, but also of animals and the entire environment. So, the basic thing that it recognizes is that the health of people is so much closely connected, not just to themselves and their environment, but also to the animals around them and the shared environment of all the living beings on Earth. So it involves designing and implementing programs, policies, legislations, research in which multiple sectors communicate. Please note the word where multiple sectors need to communicate and work together to achieve what? Public health outcomes, the better public health outcomes. So I draw your attention again to the words communicate and work together, where today's lecture is going to tell you about how to engage with groups and communities and engage with media to make this particular thing happen, that multiple sectors come together and also multiple populations come together for the benefit of promoting health. So, but why do we need to do so? We need to engage with communities and we need to communicate because it's very important to prevent, predict, detect, and respond to many, many global health threats. Recent example may be several zoonotic diseases that we've seen, and also could be the pandemic that we've witnessed. That there are interlinkages between our own environment and the species that live around us and us. So this is very important. So this is a CDC's depiction of One Health, wherein you can clearly see One Health actually between people who protect human, animal, and environmental health and other partners on one side. And what is their aim? Their aim is to achieve the best health outcomes for people, animals, plants, and environments. But in the core of it is the coordination, communication, and collaboration, which are very, very important. I draw your attention to these three aspects, which is coordination, that is coordination among people themselves and groups of people and policy makers, people of different sectors. How would that happen? That happens through communication. And for communication, you need community engagement, you need media, different kinds of media in the process. And once the coordination and communication happen, then large collaborations can be forged, and these collaborations can in turn be useful in actually promoting One Health to achieve the best outcomes, not just for people, but also for environment and animals. So who makes it work and how does it happen? If you look at this, the government officials are very, very important in this because they are the ones who keep the data, who track the diseases, who track multiple health outcomes of other people. Of course, there is a lot of interest of the researchers. Researchers are wide spectrum of researchers. There could be veterinarians, there could be environmentalists, there could be medical doctors, there could be health related researchers, there could be social scientists, and many of them. And there are several workers who work across the sectors at local, national, regional, and global levels. And they should implement joint responses to health threats because the responses of should cut across various geographies, cut across various regions, cut across various countries. So there should be an interlinkage between all of them. This includes developing shared databases and surveillance across different sectors. So the databases that are available should be shared, should be communicated, should be interpreted in a way that they make sense to a wide spectrum of populations, including lay public. Also identifying new solutions that address the root causes. So we have to think out of box in many of the cases that relate to health. So the out of box thinking is very important to identify those new solutions and the root causes. The linkages between the risks and impacts have to be studied, and that's where several groups of people, several communities, and within a community, several people, individuals should come together. So how does it work? It works in a very broad way by enhancing cross-boundary exchange of relevant data. As I said earlier, that the data needs to be exchanged from across the borders within the states in a big country like ours, or across the countries in situations where the diseases usually these days, because of the connectivity, because of our movement, we see that the diseases cross boundaries very easily. So the exchange of relevant data in that context is very important. Strengthening community surveillance and food system sustainability, that is also an important aspect of One Health, where the community itself is engaged in surveillance, in understanding, in seeing, in following the threats, and then in stopping the threats. And also the food system sustainability needs to be because the food systems across the globe are now interlinked, and those food systems should be ensuring that food supply, quality food supply, and nutritious food supply, safe food supply across the borders to all populations. So it works by strengthening the community involvement. There is a need for developing intersectoral and epidemiological capacities. So each country, each state, or each at the district level, or maybe at a very local level, people should be able to have enough epidemiological capacities to quickly track, assess, and see health related issues. Strengthening information and communication technologies, which is very important, because there should be intersectoral dialogue, as well as there should be inter-community dialogue, and the dialogue between the policymakers and the implementers, as well as the dialogue between the policymakers, implementers, and the people. So rapid scaling up of integrated public health laboratories that include both human and veterinary laboratories are also important. Strengthening risk communication and community engagement, which is a core area of our topic of interest today, is what we are looking at. So this is our important area. Apart from all these things, most important is strengthening risk communication and community engagement processes. And our lecture today focuses on this particular area. Where then is the role of community and community engagement in disease control? Why do we need to engage communities in disease control? That is to promote risk reduction behaviors among people. People need to have less of risk reduction behaviors. For instance, if they know about the possibility, say in a case like Nipah virus, the possibility of the virus spreading from another species of animal through a fruit or through some other contaminated food to individuals, and then how risky it could be. So in order to reduce such risks, the simple thing that people need to do is to take fruit that is not cut open, or the fruit that is not that is intact in all the ways, and then if there is a small injury on the fruit that should not be consumed. So I mean, there are several of such risk reduction behaviors that can happen if one understands the entire cycle of how each species is dependent on the other. Similarly, to support early detection and containment of the disease, people should also be aware of the symptoms. People should also be aware of the possibilities of spread of diseases. People should also be aware of the ways in which they can maintain their local environment and climate and things like that, and how they can have climate resilient health conditions. So if people have all these, people can detect, or they can also support the containment of disease at their end. Enhancing the perception of risk, until unless people have better perception of risk, one cannot ensure that any kind of communication really makes sense to them. If people think that they are at risk of a health condition, they are likely to definitely take up the behavior that is suggested through communication. Similarly, improving the perceived self-efficacy. Self-efficacy is nothing but, in social sciences and health communication, self-efficacy is a term that is used to define the ability or the perception of an individual on the ability to follow a particular behavior that is suggested for promoting health. So, if, for instance, to combat overweight and obesity, if one is suggested to consume less of high fat and sugar and salt foods, and also processed foods, making it environment friendly. At the same time, take a physical activity. If a person believes that one is self-efficacious, and the person believes that one can practice the kind of behavior that has been suggested to him or her, we say that the perceived self-efficacy of the person is really good. So in this case, what we are trying to say is, for community to get engaged, the necessity of improving the self-efficacy. It is not just enough if people have higher risk perception. People should also think that they are able to do the kind of activity or the kind of favorable behavior that is useful for them to keep the disease at bay. So if these two are enhanced, then it is possible that any kind of health communication can be successful. Therefore, community engagement should also enhance risk perception as well as the perceived self-efficacy of the people. So before we go into community engagement itself, isn't it not enough, or isn't it not necessary for us to look at what exactly communities are and how do we define these communities? Community can be defined in various ways in terms of health or health related issues, and also in social sciences, the communities are defined in different ways. But simple thing, it could be at various levels. The word community can mean various things. For instance, community can be a group of people with similar problems. For instance, under mothers of under 5 children are all one community. Say mothers of under 5 children in South India, mothers of under 5 children in India can be one community. Similarly, pregnant women who do not have access to health care can be one community. Uh, that means there is one homogeneity in an entire group. Uh, they can be called as a community. Similarly, if it is a geography related community, a village can be a community, a township can be a community, an area can be a community, or Indians in all can be a community for global health related issues if one is looking at. So similarly, somebody who has an homogeneous work or objective towards work, like all healthcare workers in a particular region, they can be a community. Or community can also mean somebody who does a similar kind of work across a broad geographic area, like grassroots level health functionaries, maybe Anganwadis, maybe Ashas, maybe grassroots level health workers, and then the PHC workers and others who can also be a community. And of course, media itself can be a community. And our social media, we also have virtual communities. So these can also be communities. Virtual communities are people across the geographies are of similar interests come together as one community. So they can also be called communities. So communities, the very term communities is so broad based that it depends on the problem that you are trying to address, which kind of community you are trying to engage with. So we should always bear in mind that communities are not constrained by geographies, but they are more united by the homogeneity that we are looking for. So now that we know about communities, what is the process of community engagement? What does it entail? The process of community engagement is nothing but developing relationships. Please pay attention to the font in red. Developing relationships. Why? That enables stakeholders. Who are stakeholders? There could be, a wide range of stakeholders. Industry can be stakeholder. Policymakers can be stakeholders. A community can be a stakeholder, and their influencers can be stakeholders, and also the implementers of policy can be stakeholders. Health workers can be stakeholders. So multiple stakeholders. The agriculturists could be stakeholders, and the environmentalists could be stakeholders. Veterinarians can be stakeholders. Anybody can be a stakeholder. So this is a process of developing relationships that enable stakeholders for what? To work together and do what? To address health related issues and promote well-being to achieve positive health outcomes for everyone. So this is community engagement. So oftentimes what happens is when it comes to health communication, we tend to concentrate all our health communication at an individual level. So we assume that people do not know a lot of things. So like, our entire health communication is always focused at telling people about or informing them of what are the good behaviors, why, what one should do to actually keep a particular disease away, an infection away, or how one should consume food. The assumption most of the times is that people do not have the information, and so their behaviors are compromised. Sometimes it may be wrong. People may know what is already there. People may have the enough knowledge, but their enabling environment around them may not be entertaining them to change their behaviors. Therefore, just informing people is not actually getting their participation. To engage with the community is not just to inform them in a top-down approach. Is consultation with the community to know what their problems are, to know what their constraints are, to know what the factors that can promote, the kind of health behavior that you are suggesting. Is that enough? No, even that is not enough. Involving the community is very, very important. Involving the community to what extent? Just to find out what media they use, or what their problems are, or what their level of engagement with the health issues is. That is not enough. Involving the people should be uh, the process of collaborating with them in terms of identifying the problems, as well as identifying the solutions for the existing health problems. So community or the people as equal partners is very important. The collaboration part is very important. And finally, to empower people. Empowering the people is that even when the support is withdrawn from the community is able to carry out the behaviors, carry out the health promoting behaviors all by themselves with the resources that they have. They are able to take decisions, and only then the communication or the level of participation is considered to be successful. If you take Einstein's ladder of communication, you can see on the right side of your screen. Einstein's ladder says there are many things that we do in terms of when we interact with the community as health communication specialists. We sometimes it is only that we manipulate their existing behavior, or we suggest therapies. But is it any participation? Einstein says it is non-participation, completely non-participation. Okay, if you are informing people, consulting with them, and placating their fears, or we are trying to give them solutions to the fears, are we engaging the community fully? No. He says it's only tokenism. We are only trying to see how the community is given the information in a top-down way here, but we are not trying to get their involvement completely. When the partnerships happen, when the delegation of activities happens, and when the people themselves take the control of finding solutions to the problems and assessing their own problems, then it is called citizen control. The most desirable community engagement are the steps 6, 7, and 8, and the least preferred are 1 and 2, and 3, 4, and 5 often give us an opinion that we are actually engaging with the people, engaging with the communities, but we are not actually engaging. We are still keeping the entire process top down. So when is it real community engagement? When they play an active role. Yes, as I said in the steps 7 and 8, as I said in the previous one, 6, 7 and 8, what happens at this juncture is that when people start playing an active role, defining the issues themselves, considering the solutions by themselves, and identifying the resources and priorities for action. So here the engagement or involvement of the people is meaningful. And then people also do that kind of engagement in researching and trying to know their problems, planning solutions, and implementing such solutions to the existing health problems. Then it is called the real community engagement. Community engagement from perspective of communication is not just sharing information. It encourages exploration of choices and options, and of course closes the feedback loop. Feedback loop is nothing but from sender to receiver. The communication goes through various stages. A sender actually has a message. The message is designed in a way that is suitable for the medium that one is taking. Once the medium is chosen, through the medium the message is disseminated, encoded and disseminated to the people, and the receiver actually receives the information, decodes the information, and the process of telling or communicating back to the sender that the information has been understood the way it has to be understood is called the feedback loop. A communication is a two-way process, and only when the feedback loop is completed do we call that the feedback loop is closed, and only then the community engagement is possible to the fullest extent. So there are certain principles and enablers for community engagement. If you look at the principle, trust is the most important principle. If you're trying to engage with any community, the community should feel that you are trustworthy, the organization is trustworthy, or the doctor who's talking to them is trustworthy and transparent. How does trust come? It comes through transparency. So the information that you share, why the information is being shared, and what is the health problem that is likely to occur to them, and where is it coming from, all these should be through very, very thoroughly transparent, so that the people gain trust in whom they are communicating with, and access to health facilities and knowledge. So it is not just enough to say people to change their behaviors for improving one health or planetary health or health of the species around them and the environment and their own health. The facilities that are necessary have to be provided to them. That is, the enabling environment needs to be provided. And then equity. The social determinants of health are always outside the health sector. The social determinants are the availability, accessibility, and reach of the health facilities, and affordability of the health facilities, and the economy and the infrastructure around it, and the collaborations between health and non-health partners. All these are important, and they determine the health of the community, while not just their own individual behaviors determine. So all these should be equitably distributed, and then people should have that empowered feeling in them so that they can participate. Autonomy of individuals and communities. People should be free to think because they know their problems better, they know their available resources better, they know their enabling environment better, and thus they can find solutions themselves better. So engaging with people and communities is always for finding solutions that are specific to them. What are and how do these principles and how these necessary things for community engagements are usually achieved? They are achieved by providing enabling environment which is possible by good governance, or the governance that is transparent and trustworthy, leadership, and the decision making, instant decision making, or the decision making when it is required and what kind of decision making is required, communications and collaborations, and engaging with partnerships. There are different people working in the same area of promoting One Health. What are they communicating? What is already communicated, and what is the what is that? What are the gaps that are there? These need to be understood. And are we likely to participate and partner with the people who have similar intentions? That also need to be looked at. And resources for enabling environment. So to create enabling environment, what are the resources that are required to the people? also need to be looked at. And there are several approaches, and they are often confused with each other. There is community-oriented approach for community engagement. There is community-based approach for community engagement, and there is community-managed approach, and there is community-owned approach. Let us see what these approaches are. So, community engagement approach is nothing but the community-oriented approach is nothing but the examples of such things are, I've taken this from WHO. You can just see what are community-oriented approaches. Behavioral, cultural, and social conditions, such as, see, vaccination during outbreak and response, awareness on harmful products and exclusion, gender bias, drunk driving, all these are behavior related. So these are community-oriented ones, which are related to health promotion actions that can be done. And what kind of health promotion actions can be done to promote this? These are dependent on personal skills and individual skill, and strengthening the action of the community to make a person change one's behavior and creating supportive environments. This is community oriented. Community based is health systems determinant, that, like, the acceptable primary health care services, the information and programs for communicable and non-communicable diseases, and what are the new outlets for various kinds of diseases. So the community based approaches, what do they need? They need developing personal skills, strengthening community action, and also reorienting the existing health systems. That is because if the health systems are not reachable, not accessible, not useful for the community, you learn from the community, and through community you try and reorient the health systems the way they are helpful for them. Community managed is where the community itself participates, like, finding solutions for unemployment, finding solutions for the environmental degradation that is happening within their area. For instance, somebody is garbage management is bad, or maybe there are stray animals, and there is lack of water and sanitation projects, and lack of access for girls for education, and there is food security issue. Then how the community manages? It involves, like in the top two approaches, it also involves development of personal skills, strengthening of community action, creating supporting environments, but at the same time building healthy public policy which can make community participate or manage its own resources. Community owned is the most desirable but very difficult to arrive at. That is like the working conditions, the climate change, and other things. People should have own the responsibility. People should look at environmental degradation as a thing that is going to affect themselves and affect the future generations. What do they need to do? They need to build a healthy public policy, and they need to reorient health services, and they need to create supporting environments themselves, and the community is fully engaged in doing so in this particular approach. So these are mutually exclusive approaches. At the same time, they look same, but they are different. The health related actions that are possible, if you see the last column, you can see it's not just the personal skills and the strengthening the community action and creating supporting environments, but also reorienting health services, building policy that is enabling them to work the way they need to work, and all those things happening at one go. The first part of community engagement, while it has become very theory oriented, but to conclude this session, I think what we need to, in order to conclude this particular session, what we need to look at is that what we have learned in this session on community engagement for promoting One Health is that community engagement is a very, very effective strategy. And sometimes the community oriented approaches are very mutually exclusive. At the same time, the appropriateness of an approach will depend on what is the objective of community engagement. So people themselves have to be considered. They are the change agents, stakeholders, and social networks can happen by engaging with the community. And health promotion capability, previous health promotion actions we need to know. We need to consider what are the other actions that the others have done, who are the people who are working on a similar lines in the community, and how can we complement them or supplement them or at least collaborate with them. That is very, very important. The experiences in people's participation at community level have to be known, and they have to be custom make and contextualized to every context. They are not the same. Community engagement is therefore a process, not an outcome, and that process involves making people, own the behaviors, identify solutions for their own health issues, and track their own health issues, and being able to be finding solutions for the health issues in collaboration with the policy environment and also the stakeholder groups involvement. So therefore, this brings us to the end of the first session on community engagement in media and community engagement for promoting One Health. Thank you very much for your attention.